You've just had a skin cancer removed. The stitches are in, the wound is healing. And then the question comes, what should I actually do now to get the best scar? Let me show you how I advise my patients in clinic. This is not the only method, and it's not a fixed method for every doctor or for every wound, but it is a simple, practical method that has worked well for my patients in my own practice for many years. Always check with your treating doctor first when undertaking scar care to improve the scar in your situation. First, the early phase. For the first few days, this is not a scar yet. It is healing, so keep it clean, keep it covered, avoid pulling on it. And if it's still weeping or oozing, keep it covered longer. Then, around day 4 or 5, the surface starts to close, become dry, and not weep. Even with the stitches still in, you can start with simple scar care. This is where I keep things simple. Just a thin layer, a light layer of petroleum jelly or Vaseline. Not thick, just a light layer once or twice a day. So this is white petroleum jelly or Vaseline. That keeps the surface lubricated and protected. It also slows water loss and keeps the surface environment stable so the healing process stays more controlled. I do not routinely recommend antibiotic creams or antiseptics like betadine, only if the wound starts to look red and inflamed, a little angry, then we reassess. Otherwise, simple is better. If the stitches catch on clothing when this dressing is removed, you can lightly cover the area or use a small piece of micropore tape or small steri strip over the suture lines. Okay, so micropore tape, as you can see, skin tape, surgical tape that you can apply on the wound. There is also skin colored ones. For example, this one, you can hardly see the tape on your skin. And for steri strips, yeah, these are steri strips. So, yep, it's applied strip, and you can apply over it, over the poking ends of the stitches. With the micropore tape or the small steri strips over the suture ends that pokes out, that will reduce friction and makes daily life easier. If the area feels like it's pulling even before stitch removal, that is already a sign of tension. In that situation, a light support can help early. Continue with this with a petroleum jelly, Vaseline, or other ointment. Some Vaseline as well, just a light thin layer. Even this is quite thick. So continue this until stitches come out. Then after ROS or removal of stitches, this is where the scars are shaped. Most people think of using aqueous creams, which are the white, creamy ones. However, the biggest factor here is tension. If the skin is constantly being pulled, the scar might widen. So this is what I emphasize to my patients. Micropore tape across the scar, especially in areas that move a lot. For example, our chest, shoulders, and up back. And also the lower legs, where it's tight. So this is simple, cheap, and very effective. And this is the key point many people miss. It's not for a few days, not for 1 week or 2 weeks. Think at least 6 weeks and often up to 3 months if you can. This early phase is when the scar is most vulnerable to stretching. And what you do here can have a lasting effect. So just take a tape Longer is okay, and put it across the scar. So take the micropore tape and put it across the scar. Yep. Okay. This will help support the scar and reduce the tension on the scar itself. Practically, micropore works very well. It is hypoallergenic. You can get skin-colored versions that can camouflage, and it can stay for several days, even a week or two, even with getting it wet and showering. The consistency of support across the scar, reducing the tension, is what helps. You can still use a very small amount of ointment, even over the micropore tape if needed, but again, only thin and light. If you're using silicone gel, the silicone gel needs to go directly onto the scar, dry first. After that, you can put the tape over it if you want. Use a longer strip, but just remember, whereas micropore tape alone is often simpler, cheaper, and lasts for days. Now, very commonly in Australia, patients ask me about bio oil or vitamin E cream. These are familiar products and many people trust them. They mainly act as moisturizers. They can help keep the skin soft, but they do not reduce tension. They do not replace taping. So if you use them, think of them as comfort, not as structure. So let me bring this together simply. So after the wound closes, keep it soft, reduce tension, and give it time. That combination matters far more than any single product. If you found this useful, share it with someone who's about to have a skin procedure or just had one. And if you want more on scars, raised scars, thickened scars, keloid scars, silicone, and what works and what does not, have a look at the other videos on scars and silicone in my playlist on this channel. Calm, practical, no hype. That is how I approach it.